Welcome to Adapting Class. Thank you for deciding to watch this video. Have you taken a look at your candidate performance report and you said, what is NCLEX telling me? What are they telling me? I'm confused. I don't know what to do. And then you said, what is this? Well, I can tell you there's something they're telling you, but they don't want to make it clear to you. They want you to take a look at it critically. And today, that's what I'm going to do. We're going to walk through an example of a performance report from an adult NCLEX and learn how to analyze it for yourself. And then you can come up with the plan, a game plan for your next attack if you have to take the exams again. The report will break down your performance in various domain or category related to nursing care. Each category is rated based on a certain standard, a passing standard, whether you way above it, that is above the passing, or near passing, or below passing. What people get confused, every exam, board exams, they set some mean and they have some standard deviation. How far your standard deviation from the test is what I think, NCLEX has changed into near passing, below passing, above. Near passing may be just above it or below it, and above passing, you way above it, like here. Below passing, you way below it. So near passing may mean this. That means you close to the mean. You can be just above the mean or below the mean, but they're not feeling comfortable. The computer does not feel comfortable. They want you to be probably one standard deviation above the mean. So this is a calculation we do when we do statistics. You don't have to worry about it, but you just up above it or you just below it. That means you're not showing some consistency in your thinking regarding to that category. Remember, the performance level show how well the test taker perform in specific areas of your knowledge, nursing knowledge, and critical thinking skills. So you ask yourself, well, I have good nursing knowledge, good critical thinking skills. The report does not reflect who you are. It reflects the situation, the time you were taking the test, what happened, what kind of strategy you have, and whether you start freaking out and then you lose your test taking strategy. So your action at that time when you were taking the test, I think, is a reflection. If you go in with strategy and you stick with it, you don't panic, and then you bring your content, you make it true. So don't let them fool you. So that's that. This is an example of report. And we're going to look at what happened to the individual. I hope you can see, but this is a manager of care. We have near passing. One, safety and infectious control, near passing. Two, health promotion and maintenance. Three, near passing. Psychosocial, above passing, right? Basic care and comfort, near passing. So we have what? Four, near passing. Pharmacology, near passing. Five, risk reduction, below, right? One below, two, and then seven, near passing. That is physiological adaptation, clinical judgment, near passing, recognizing cue, near passing, analyzing cue, below, near passing, prioritization, above, passing for generating solution, taking action, near passing, and then evaluation, near passing. How many near passing? Almost like 11. Let's count it. 11 near passing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 11 near passing, 2 above passing, and 2 below passing. Do you think this next fail or pass? Think about it. 11 near passing, 2 above passing, and 2 below passing. Think about it, whether this next fail or not, and I'll show you. This is how I analyze the results. So management of care, they were near passing. That means their performances in coordinating care is close to acceptable, just average, right? But it needs some improvement. Safety, the same thing. They need some improvement in terms of infection prevention and safety practice, right? They need to master that area. Health promotion, they were like perfect. They can prevent, they're very good at health promotion, right? looking at what is going to happen and educating the patient. So a very strong area. Psychosocial, right? Some a little bit of tweaking so that they can learn how to handle mental health cases to be able to analyze them. But when it comes to pharmacology and medication administration, it's also near passing. There's some consistency is needed. Risk reduction, big. Risk reduction, big. Risk deduction, big. Reduction of risk potential. Look at it. This is what nursing is about. Reduction of risk potential. Below passing will kill you. Below passing will kill you. This is an area that requires significant improvement for the individual. I will explain it to you. Study this. They need to study ways to reduce complication and assess risks effectively. That is key. Physiological adaptation is also very important. I will explain it, but it needs some fine tuning. They're very near passing. It's not that bad compared to risk reduction, right? That means physiological adaptation is related to chronic diseases and how you can teach the individual to, like you have CHF, I'm teaching you how to coordinate. You can see all this physiological adaptation, risk reduction is merge search. It's all like all medicine and surgical. So chronic condition fall under physiological adaptation. When it comes to case study, they're very good, right? Generating solution, they were above. They can come up with the plan based on the case study. They can show strength in problem solving. So that is good. They've mastered how to manage that. They can recognize cue, they can prioritize, they can evaluate outcome and take action, but it's not perfect, right? They give them the case, they know what is the problem in it is, and they can say, oh, this is what is going on, but they are not consistent, right? If they ask them which signs and symptoms for these should they intervene, or they can see it and they can say, oh, this case, this patient, we should intervene at this, right? If you look at case study, they may tell you. And if they know what the case is about, they can evaluate the outcome, what therapy they're going to provide to the patient. But what really affected them in analyzing cure, they can't connect the buzzword. Like I said, you connect the buzzword and you say, oh, this is what is going on with the patient. This is related to the risk reduction. Analyzing cues will go with risk reduction. You want to analyze the cues and say, hey, you can recognize it, but analyzing it is how it's going to affect the individual. So they were below passing. That required critical thinking. That is what case study is about, that one. So with these results in a pass, do you think this individual pass? I said in adaptive tests like NCLEX, passing depend on consistency. You have to demonstrate consistency in multiple areas. And that means you have to have a bunch of above passing, not near passing. Based on the report, you can tell that the individual has strength in health promotion and generative solution, but they're weak in risk reduction and critical thinking, and that is the key. My take, while several areas were near the passing area, um, the below passing standard in the risk reduction is what make this individual fail, right? They did not do well. Um, this will prevent a pass because of risk reduction. I think that's what killed them. Consistency scoring above risk reduction is needed. You need it to be able to pass the NCLEX. That area is key. How would they improve? Well, they should focus in areas of risk of reduction, reduction of risk potential, and critical thinking. And you can see what it comes in it. You practice prioritization, and then you practice decision making. You got to make the decision. Who do you see first? Who do you see next? Like, what do you do next? And recognize cues through case studies. That, oh, I call them buzzwords. You connect, when I say connecting the buzzwords to figure out what is wrong with the patient, yes. And then if you're using any resources, you should stick with it. So this is I'm talking to the individual whose report is that. Is you if that's your report, stick with the resources. And if your report looks similar, stick to one or two resources. Don't say, okay, I'm going to another place and go find, unless you don't connect, right? The content is not enough. But just try not to keep on jumping from one place to another. Remember, adaptive tests aim to address overall readiness, right? The overall, right? If you weak in certain area, it doesn't mean you throw your strength away, right? Work on your weakness, but bump your strength also. Bring your weakness through towards your strength. And those that you strong at, maintain it. Don't lose your strength. I think that's what happened. Multiple testing is related to dropping your strength and focusing on weakness. And when you go to the test, you have a new weakness. We don't want that. We want our strength to be tight and bring up our weakness towards where our strength is. And that is the key. NCLEX is designed to assess whether you are ready to provide safe care. So that's why I said risk reduction is key. Critical areas for safe practice in medicine, safe care, and effective nursing. So which areas you should pay attention to? Reduction of risk potential. Look at it. It focuses on identifying and minimizing complications that arise during patient care. So when you're taking care of the patient, you focus on we do it, but you don't think about it. When you're taking care of a patient, if you're working right now and you get the report, you go and assess the patient. So you're looking for things that will make the patient sick. So throughout your shift, all you're doing, you're trying to identify and minimize complication with the care, right? If it happened, you want to see it quickly, right? Such as early detection of things that will come. Or if you've seen that the patient condition is changing within a very short time, then you implement care. You call the doctor, you intervene. If you walk in and there's desarding, what do? You raise the bed up or you give them oxygen before you call the doctor, providing safety precaution. And when there's emergency, quick, you respond to that and you know what to do. First, you know how to recognize. First, you try to prevent measures to deteriorate to prevent deterioration. And when they happen, you can see it. And if it happen, you can treat it. That's why risk of reduction of risk potential is very good. And this is area is like weakness in this area raises concern about the test taker's ability to be safe and provide safe patient care in rare scenario. And computer, I bet you they they've written programs for the computer to tell the computer that if individual is doing this, hey, there's a red flag. Okay, so you got to be careful. So what did they do with minimum passing? How do you know? How did they create a minimum passing? This is the way I think, right? I'm not in English mind, but this is a board exam, so you can figure out through a pattern. Adaptive testing system, like the English, what it does is it give you a question. If you answer it right, the next question is supposed to be hard, and then as soon as you keep on getting difficult and difficult and difficult, so you're going up and up and up. If you get it wrong, it bring you down a little bit to your level, but you want to be above everybody where the mean is. You want to be above the mean. The mean is not enough. So it require a consistent demonstration of competency, right? This means you must meet or exceed the passing standard, right? In certain areas, like especially safety and infectious control, reduction of risk potential, and management of care. These three areas is key. There's other two, you can also hold on to that, and then you form a pentad of NCLEX. That's what you hold on to. Safety, infectious control, reduction of risk potential, and management of care. And I will show you the other two. You can bring them to, and the other two, the other section, you can just figure your way through, and you can make it. Scoring below these areas is going to be a problem. I mean, it will be a problem for you if you weaken safety and infectious control and risk reduction. Once again, risk reduction is a big topic in management of care. So I call it holistic safety, right? Why risk reduction is my guy, right? Risk reduction overlaps a bunch of domains. If you're recognizing Q, you'll be able to solve case study easily. Prioritization, you can do every category. You can cross all Every areas there's prioritization, so you can prioritize hypothesis is easy for the computer to detect that, hey, you know how to reduce risks, even if it's fundamental, management of care, everything you going through, right? And you can take appropriate action. That means you can prevent safety, you can intervene in critical condition, you can take care of it. If you're weak in this area, there's a way you can improve it to help you pass. I want you to learn how to recognize early recognition of problem. So identify signs and symptoms. So every time you watch my video, I always say signs and symptoms, and those are what buzzwords for the condition. Example: I can tell you 3 words: 3-year old, projectile vomit, right? And scaphoid abdomen, and what? Palpable mass. That 4 things I said, pyloric stenosis. Put it together. You don't even need any more information in the case. Left lower quadrant pain, nausea, white count, right? And fever. Most likely it's diverticulitis. You see how you can figure out this condition, right? A newborn, fruity saliva is choking when you feed the baby. Insecting of NG tube is not possible. Is what? Esophageal atresia, tracheoesophageal atresia with a fistula, right? These are buzzwords you learn and you identifying signs and symptoms of potential complication. It's not enough for you to know what sepsis is, but the board wants you to know how to you reduce risks for this patient. So you'll be able to identify complication and intervene. Intervention: learn the critical nursing action to prevent the problem. If you know renal failure, what do you see that we know will cause problems? So you minimize that. You teach the patient to avoid potassium, right? Patient come in 4 weeks, you know how to set the bed, which level the bed is going to be, right? Patient had a seizure or patient has preeclampsia. You know some of the things you're supposed to do. Prevention ahead. You know you need to be on magnesium. You know the bed is supposed to be in the lowest position. You know the patient has to be on their left side. These are all thinking things you expect. You can't say, oh, I'm studying seizures or preeclampsia and I'm not thinking about all these things. They're going to ask you about preeclampsia. Knowing preeclampsia is not enough. Just I know that the lady is pregnant more than 20 weeks and the blood pressure is high. It's not enough. That will not help you pass. What will help you pass is what you prevent. That mommy can go into seizure. I need to provide seizure precaution. I need to prepare for delivery in case that happen. If the mother is on magnesium, you know the things you're supposed to have at the bedside if they develop magnesium toxicity. Then the next thing, if they are magnesium, I know the things I need to check, right? Urine output, respiratory rate, saturation, and neurological status, and reflexes. This is what it means about by risk reduction. And now, of course, my favorite, prioritization. You got to get your B sharp on, right? Use practice questions to build your skills how to prioritize patient safety. So I'm going to take each segment. I'm not saying all the segments you see on the report are not important, but I'm going to show you why they put it there. But you got to get certain 3 or 4 of them strong, right? So why infectious control? This is going to assess your ability to prevent infection, right? So inadequate performance here indicate you lack understanding fundamental safety precautions in terms of infection. So um, this is where the computer will detect a safety and infectious control issue. Management of care, we got to delegate. As a nurse, you should be able to delegate tasks. You have to use your resources. It's very crucial for smooth uh, running of operations. So you have to know that. So you should be able to, if you score low here, that means you can prioritize and delegate responsibility. Of course, my favorite, the domain focus on identifying and mitigating potential complication. That is why we take care of a patient. We want to identify it and mitigate. Look at it. Even safety and infectious control is all based on this reduction of risks, right? It's based on it. If somebody have TB and you know how to take care of them, they come in, you know what room you're supposed to put them, you know what kind of precaution, you know what precaution you need to take when they're going for CT scan, reduction of risk potential. You must be proactively prevent issue from getting worse, right? Failure here indicate a gap in identifying risks. You cannot implement prevention and you can't respond to it. Three things that happen when you have low. First, you can't identify the patient's in trouble. You can't prevent it when you see it, and you can't respond actively, like in a critical care. And that is a core aspect of nursing. Identify risks, preventing what? Implementing preventions and responding to complication. Physiological integrity, like I said, is a chronic condition. Your body like it because a lot of people have chronic conditions. So it tests your ability to help with the patient, include one, those with chronic conditions, they may have basic care and comfort. How can they take care of themselves? Their nutrition, their basic need, how to move, right? Those like heart failure, COPD, and other thing, they fall under that, right? If you can't provide their need, they cannot progress through the healthcare system. And under that is the physiological adaptation in it. So be able to manage patients with chronic condition, what is going to affect them, their respiratory status, their fluid level, um, and if you're having problem with this, it's because you can't do critical thinking, critical care, emergency situation. This is where you may see EKG questions here, right? Fluid, electrolytes, potassium, all those things, respiratory failure, like somebody with a CHF and is on furosemide. Yeah, you got to be able to manage the electrolyte, that is going to affect them. How is that going to affect their performance? If they have muscle cramp, you know this is a potassium problem. It's all related. Pharmacology is also important, but I think the NCLEX may be okay with you if you just because you don't know certain medication. I don't think that's what makes you fail. I mean, there's tons of medication, but you have to be safe. So safe, and you can see that most pharmacological question is related to what? Risk reduction, reduction of risk potential. When they ask you about medication, only few they want you to identify it, but most of the time when they list the medication, they asking you what is your priority. That means you identify the risks associated with the medication, and if it's an overdose, what do you do? How do you intervene? So even in the pharmacology, they put all the answers as a reduction of risk potential, right? Psych is important, right? Psych is important, but this is also an area they may be lenient to you, but there's certain portion of psych you have to know, certain conditions like Alzheimer's and other things, but it's also very important. All of these areas are very important. Mine five. If you can't get a five, at least four, right? Safety, infectious control. These are high yield information that you need to know. Management of care, and the favorite, reduction of risk potential. Physiological adaptation will give you information about risk reduction. Management of care is connected to risk reduction. Safety and infection, risk reduction. So when you're doing all of them, say how can I identify the risks? How can I take care of it in emergency? Every one of them, that's the way you think. When it says somebody has varicella infection, risk reduction. How can I prevent that person from infecting another person? If I'm taking care of that person, how can I prevent myself from getting sick? If they're going to X-ray, how can I prevent that? Those are intervention, teaching, selected, apply things you know. These areas are foundational to the patient safety and care. If you score poorly in that area, the computer will determine you are not ready for independent practice. What does that mean? Look, if you go to YouTube right now and you type a keyword, you put a keyword into the YouTube system, you tell the system that, hey, I'm looking for this video, this topic. The computer, there's a program, they rent a program, and they say, if you see this keyword, generate these videos. And they will give you a bunch of videos and then you select. That is what the NCLEX is. There is a keyword on how to pass. They have combination of factors they can put in and say this, that, that, If the individual is consistently is scoring below this level in this category, we're going to fail you because we can detect that you're not safe. That's why the computer will shut up at 85 and you still fail, or shut up at 85 and you pass. That's why the computer will keep on giving you question after 85 because you think you safe, but you're not 100% yet. Let me keep on giving you more and see how safe you are. That is the my takeaway about all this. So, what do you do with this? Don't panic. You got this. When you get one, look at it, watch this video, analyze it, build on your confidence area, your strength area, and go and tackle your weakness here and bring it up. Don't forget about your strength. And if you want me to read yours, send it to me at adaptingclass at gmail.com. Adaptingclass@gmail.com. Thank you. And if you like this video, share it with your friends. Take care of yourself and happy studying. Good luck. Bye.